office assistant here, and I will be doing a video to demonstrate different measurements. So the first thing we'll do is take a temperature using the thermometer. I have washed my hands and followed standard precautions, and I have the equipment ready with the electronic thermometer. I also have the probe covers that I will put on the thermometer. And I have my biohazard waste container for after the measurement, and I can put the probe cover in there. So first I will introduce myself to the patient, and then I will also identify that this is the correct patient. Hi, I'm Delia, the medical office assistant here. Can I just verify that your name is Pixie Jordan?
Yeah,
Okay. And your birthday is December 25th, 1987.
that's correct.
Thank you. Have you ingested hot or cold drinks or food, or have you been smoking within the previous half hour?
No.
Okay. So I'm just going to do a procedure for getting your temperature using this thermometer. Okay. So first I will cover the thermometer with the correct probe cover. And then we'll insert that into the mouth where the cheek is, and I'll ask the patient to close their mouth without biting down on the thermometer. I will leave this in until the beep goes off. Okay, perfect. And so we have the temperature, and I will record the temperature on their chart. Okay, so after I get the temperature, I will discard the probe cover that I have into my biohazard container. And then I'll make sure that I have the patient chart ready to go and record the temperature.
Okay, cut.
Okay, so next we will be doing the pulse and respiration measurements. I have the patient here sitting with me. The patient has their arm comfortably placed, and I will ask the patient to move their wrist facing upwards. Perfect, thank you. Okay, so I will be measuring your pulse now. While I measure the patient's pulse, I will also be measuring the respiration rate. I will do that without them knowing about it, and usually that's what you do because you don't want them to be conscious of the fact that I'm measuring their respiration. Okay, and I have the patient chart here for recording their respiration rate and their pulse. Okay, and so first you just locate the pulse here, and I'm using 3 fingers to measure. And I have my phone here for the measurement. So I will start the measurement right away here. I've located the pulse, and I am staring at their chest for the respiration. And I'm going to start for a minute. Okay, so I'm taking measurements of both the pulse and the respiration. And I will write it down on their patient file here. So there's been no irregularities in the rhythm, and the volume or condition of the artery is great. Okay. Okay, next we're measuring the blood pressure for the patient, making sure all the equipment needed is provided. And so I'm just going to have my cuff ready, and we're making sure that this is the proper cuff size for the patient. And this happens to be the right cuff size. And we're using the right upper arm. I'm also making sure the brachial artery is at the level of the heart, and the arm is supported so that there is no extra muscular tension. Okay. So we're placing the cuff right here. Okay. And I'm making sure I can see the readings on here. Okay. So So I will be inflating the cuff until the pulse is no longer heard through my stethoscope. I will note the number for that. And then I will be deflating the cuff and listening for the sounds. And then the onset of sounds as the systolic pressure, and the disappearance of these sounds is the diastolic pressure. I'll be making note of both of these for their chart, and then I will be removing the cuff. So I'll just be doing that right now. Okay. Okay, so I have the readings for that, so that's all good. I will now be removing the cuff on the patient. And this is their patient chart, and I'm just going to note the number for the patient as their blood pressure. Now I will be taking the earpiece here, and I will be disinfecting it with alcohol disinfectant wipes. So you want to make sure that earpieces are disinfected, and then of course this area is disinfected. And then afterwards I will be washing my hands according to proper procedure and making sure that the blood pressure is recorded accurately in the patient chart. Thank you so much.